that right? How does that work?
A lot of letters, a lot of loneliness. What about you? Do you have a wife?
No.
I guess you must think it's stupid.
What?
Being Elon. Do you think it's absurd to love someone that's millions of miles away?
Not at all. So ancient is the desire for one another which is implanted in us, reuniting our original nature, seeking to make one of two, and healing the state of man.
What's that?
Plato. Symposium.
What does it mean?
He says, humans originally had two faces, 4 arms, 4 legs, and they were happy like that. Complete. Then they defied the gods, so the gods split us in two as punishment, tore us away from our other half. He said, each of us, when separated, is always looking for our other half. It's our nature. When one is met with his other half, they are lost in an amazement of love, friendship, intimacy, and one will not be seen out of the other sight. The reason is, human nature was once originally one, and we were whole, and the desire and the pursuit of the whole is called love.
Hello, everyone, and welcome to our latest webinar, A Human-First Approach to Healthcare Innovation. I'm Joe Laser, Head of Marketing at A.Team, coming to you live from our NYC Clubhouse. First, just some housekeeping. Please introduce yourself in the chat. I see a lot of you have already. And if you have any questions for our panel today, put them in the Q&A box. We're going to have plenty of time for questions at the end. So, at A.Team, our mission is to bring together teams of world-class product builders, innovators, strategic thinkers to build transformative products. And that's in part what we're here to do today. You're going to hear from an all-star team of healthcare innovators who are working together to make healthcare better for nurses, doctors, and patients in the AI age. Joining us today are Katharine Kennedy, GM of Global Alliances at Microsoft, Candace McNulty, a nursing and innovation leader at the U.S.'s largest healthcare system, alongside 2 of her teammates, Kim Bielicki, one of the world's leading experts in human-centric healthcare design, and Ashley Rush, a health and wellness expert. So without further ado, I want to kick off this conversation by inviting Katharine and Candace to the stage to walk us through some top use cases they've been working on.
Thanks, Joe, and welcome everyone to today's discussion. It's a pleasure to have the opportunity to chat about this evolving landscape in healthcare and how AI can be leveraged to support the industry here. For me personally, at Microsoft, we're committed to fostering a collaborative environment where healthcare leaders, customers, partners, patients, providers, and experts alike can all come together to engage with AI responsibly. And today is a continuation of that conversation and that intention, where I have the privilege to moderate this conversation with industry experts who can give us a glimpse into the innovations needed to improve the healthcare space. And I'm eager to explore specifically the significance of the human-centered design, as well as the recommendations for how to embrace this approach while building solutions for healthcare and specific examples for how to put this into practice. So without further ado, I'd love to jump in and get started on this discussion. So we know that healthcare professionals are experiencing high rates of burnout, and many are dealing with competing demands in the field. Candace, can you share more about burnout and what's actually going on here on the ground floor?
Yeah, thank you, Katharine. I think it's really important that we kind of establish that as a place to start, right? Because that is our current state right now within healthcare. We know that nearly a third of our nursing workforce at this time is really feeling the weight of the burnout. The World Health Organization has termed it an occupational phenomenon at this point. And yet the demand for nurses and clinicians is really soaring. I think by 2031, they're projected to have over 200,000 shortages, and physicians are also experiencing this as well. So I think that if we look at the current state of the workforce and then couple that with the advancements in technology and AI, it creates a real opportunity here. I think there's really a whole new world of possibilities that can exist, and I'm excited to see how they can be applied to reduce the burden for our clinicians and the workforce that we need to sustain.
Wow. I mean, you put it into perspective, the burnout, you hear about it, but it's significant. It's huge, right? So as we think about that, what are some of the frameworks or concepts that can be used to help us find solutions to these problems like burnout? And to do that, I'd love to call up Kim. Kim, could you tell us a little bit more about your human-centered design approach in healthcare? Because I think this is super important to what we're talking about today.
Thank you, Katharine. And I'll have the first slide. If you could share the first slide, please. Thank you. So one of my passion topics is human-centered design. So you may be asking yourself, what is human-centered design, or HCD? It is an approach that puts people's needs and wants at the center. Empathy is the foundation of this innovative problem-solving methodology. It involves understanding the people we are designing for, clearly defining what the customer's problems, pain points, and bright spots are. We can utilize HCD to generate ideas, prototype, and then testing those solutions. So human-centered design views the customer as the patient, the provider, the stakeholder, and the caregiver to identify their needs and expectations. Human-centered design is at the beginning and throughout the process, not at the end or in the middle. Before embarking on HCD, it is essential to adopt the right mindset. Empathy, optimism, leave your bias behind, make it, learn from failure, iterate, creative confidence. I did some recent discovery work about a naming convention of the words nursing versus clinical triage. The clinical team came to the table with a bias. They said patients wouldn't understand what clinical triage meant, and we could only use nursing. Well, voice of the customer was quite the opposite. They actually preferred clinical triage as they felt they would receive better care and it would get them to the next steps. I always like to start new teams that I'm working off with, what is your why? Why is the problem important? Why does it matter to you? And how does it make you feel? If you are more empathetic towards the problem and have that passion and feeling about it, you will want to see the solution meet what the customer's pain points are. I like to quote Albert Einstein. If he had a problem, he would spend 55 minutes on the problem and 5 minutes on the solution. Now, this is an uncomfortable space for many of us. We don't want to talk about problems. We only want to talk about solutions. But I warn you, by not focusing on the problem, we are solutioneering and run the risk of losing our customers. My motto is that human centered design can reinforce why healthcare workers choose their employers of choice and exceed customers' expectations. I think we can all think of a time when human centered design wasn't used and we got handed a solution that didn't work. I'll have you go to the next slide, please. I want to talk a little bit about asking the right questions and why it's so important. It starts with unrushed and thorough conversations with healthcare professionals, focusing on asking those right questions and listening to the answers to find those right answers. A visual for this is a jar full of sand with some rocks and pebbles mixed in. We have to sift out the sand to show where the pebbles and the rocks are, right? That's what's important. And that's what we can learn by asking those questions. What I have showing on the screen right now is how we can incorporate human-centered design to look at AI versus humans. We have an empathy canvas here to look at the problem of jobs to be done and how AI and humans can collaborate based on voice of the customer. When approaching the subject of AI, the first questions would be the understanding what the patients and providers think about it. In technology, we often coin the phrase minimum viable product. In HCD, I like to think of it as a minimum likable product. If your customer doesn't like it, it won't matter if it's viable or not.
Minimal likable product. What a great thing. I've never heard that before. I really like that. That's awesome. So these are some great solutions. And me personally at Microsoft, we're helping organizations to think about these solutions by building a unified, safe, responsible approach to data and AI strategy. And we do that in a framework around core values. So for us, it's around really centering and focusing and anchoring around transparency, reliability, fairness, inclusivity, safety, and privacy and security. With the wrapper of minimum likable product. I love that. But I guess so that leads me to my next question. What aspects of the current healthcare landscape should we in the technology industry be thinking about or taking into consideration when designing new technology and AI use cases? Candace, could you give us some ideas?
Yeah, absolutely. I think we've kind of set the landscape and established the state of kind of our workforce crisis that we're experiencing within healthcare right now. And so I think it's really important to really think about workforce sustainability, which really brings us back to well-being. Excuse me. So as we're developing things, how are we keeping the clinician or the human that's still at the center of that ecosystem in mind and well as we're, fixing inefficiencies and different things like that. So I think they really need better tools to help them achieve this, so burnout is really avoided. Ashley, I see you gotten brought up here. Ashley, what do you take on it?
Yeah, I think there's so much possibility within the healthcare ecosystem. We do need to though, make sure that as the people coming in with the solutions and also as the healthcare leadership and members of the ecosystem, we don't fall to mistakes within the environment. So we don't want to confuse efficiency with productivity. So just because we can do something really fast or do a lot of something doesn't mean that it's being done really well. And so we really want to make sure that we're paying attention still to the quality of work. And that's really where the human comes into the piece of it, of making sure that what needs to be done correctly and with defined detail is being churned out every time. And that's really where we can figure out, and like Kim was saying, differentiate between those human tasks and those electronic tasks. And so that's one thing that we really need to pay attention to. We also don't want to assume that all clerical burden is because of inefficiencies within the electronic process and not exploring workflow processes within such a large system. And so when we look at how large healthcare ecosystems are and how interconnected they are, we really want to make sure that we're exploring all the pieces of it and that we're not just looking at the electronic means as being the part that is maybe the bottleneck, and making sure we're looking at the people part of it that it is contributing to the bottleneck farther down in the process or farther up in the process, and making sure that our interventions are truly fixing the problem and not just a pain point within a larger problem. We also, as healthcare providers and healthcare leadership, need to not assume that the electronic environment is too difficult to navigate. So one of the things that comes up a lot of the time, especially for Candace, Kim, and I, as we do our trainings, as new technologies roll out, is that people are reticent to engage because they think there's too much burden involved in learning a new system process. And so we need to be more open to change. We need to be more willing to accept the evolution of the healthcare ecosystem. But on the flip side, we also have to have processes that are easy to adapt and integrate into our environment, that don't take people out of clinical care in order to learn those processes and the equipment and all the things that go along with them and whatever problem they're trying to solve. And so it has to be easy, it has to be adaptable, and it has to be able to um, be integrated in a way that makes sense with the type of population and the type of provider you're working with. One thing that Candace talks about this a lot, one thing that works with an outpatient nurse may not be the same thing that works with her inpatient nurses. And we often have to adapt. Um, a really great example of this is how Candace and I have worked on some system redesign projects together, addressing our well-being within our employee populations. And so one thing Kim always likes to tell us is, how do we get to yes? And then the other thing that we hear a lot is, you asked and we did it. So one thing that our staff were asking for on the larger scale was ways to be able to create space for their well-being. And so a part of that is us moving towards being a high reliability organization. How do we reduce patient errors? How do we allow our staff to work at their highest possible productivity and being the most efficient while also having the least amount of errors and still feeling as though they are taking care of themselves in a way that is true to, like you said, Katharine, their value system. So we created spaces for them to be able to step away from their care and use things like virtual reality headsets and massage chairs and aromatherapy and all the things we know that allow people to really just go into themselves and take that time to rest and recharge. But then Candace's staff said, that's really great, but we're on the floor for 12 hours. We can't go outside of our floor. And so, Candace, if you could tell a little bit about how we were able to adapt. So sometimes it's just pivoting and adapting, not necessarily throwing the baby out with the bathwater when an idea doesn't work for everybody.
Yeah, I think a lot of things sound great in theory, but when you're on the front lines and providing care within our healthcare system, it is very challenging to be able to get your scheduled breaks and be able to take care of yourself in all the ways that you mentioned, Ashley. So I think one of the things we were able to do is have the tools available to them that you just mentioned, and then meeting them where they're at, which is bringing these things onto the units and bringing resources onto the units. So instead of maybe looking at having a 45-minute break where you are able to stretch or get some type of activity in, you're able to fit small pieces of wellness throughout your day that are accessible to you, that can still at least help work towards that overall goal. And we actually integrated wearables into that as well. So administratively, I had a dashboard where we're able to review that data in real time and see how these interventions we're providing on the units are actually helping or not helping that frontline staff. So I think just being really intentional about having the best versions of them show up and be able to care in this complex system. I think it's really important to remember that even in today's U.S. healthcare, 1 in 4 patients admitted to the hospital, even today, will experience harm. So we've got to do better. And I'm hoping a lot of these solutions can help us get there. I think another framework that I've kind of pulled from some of our QI and code cart modalities, when you're looking at a code blue and those very precious seconds and time and the different stakeholders that all have to come together and orchestrate this task together, and time is of the essence. One of the biggest things that we always say is that we need to make it really easy and intuitive for the nurses to do the right thing every time. So when we look at how we apply technology or AI, I think we want to look at keeping it simplistic, I think, in one way, but also just making it easy to do the right thing and further make progress.
And I really love that example because this is an easy way for us to integrate electronic wearables, right? We could bring it into this setting. It was easy. They understood it. We had a way to look at their well-being in a passive way, and yet they could still engage in all the other things too. But it actually improved their well-being on their floor. It improved their satisfaction with their job. It decreased their likelihood to leave their job over the next year when we did surveys on that floor. And so we need to look at all types of interventions that we do, AI, VR, improved scheduling systems, improved documentation systems, as bringing to our employees things that are consistent with the values of what they want, because clinicians want to create efficiency and they want productivity, but it has to be right and it has to fit what they're looking for their quality of life and their job, because most of them spend most of their lives at their job.
Mm-hmm. Good point.
Yeah, absolutely. And, I agree. I'm excited for all of the advancements that are coming, right? With the advent of AI and what that will bring and what we'll do with that technology in the healthcare system. But in your opinions, what kinds of technology opportunities exist within the healthcare space from your perspective?
I think really understanding that the frontline workers really want to do the right thing. They are excited to see how they can take off those mundane tasks that maybe they didn't go to school for, or doesn't take their talents and abilities and passion to be able to do, and taking some of that off and really being able to streamline the things that they want to be focusing on, which is the patient. They want to take care of their patients in a safe and effective manner. They just need tools and resources and technology to help them and help us to get there collectively. So, because this is a we problem, I like to say, but I think the main thing is they really want more time with their patients so they can make a difference.
I love that. I'm just going to jump in here on the we. I think we have all been a patient at one point in time. We've all known or are related to somebody who works in the healthcare system. So we are all indebted. We're all part of this solution and this opportunity. Thank you for letting me interject. I think that's just so powerful right there.
Yeah.
And people got into the healthcare field because they want to connect, right? They want to help people. And so clinicians truly are anticipating the day when practice efficiency is going to be enhanced by automated decision support, artificial intelligence, electronic team-based care, and also improved telemedicine services. They also want to be able to use excellent voice recognition dictation. They want to be able to do those things so that they can get more done. The average primary care provider, even though they're working every day seeing patients, still has to complete 30 to 40 hours of overtime just to complete their documentation and administrative tasks outside of their typical clinic. And so we need to create processes that allow them to go home and have quality of life, to see their families, to connect with them as well, because they may want to be a healthcare provider that connects with patients, but they also want to connect with their families. And so how can we make this a system that works for them too, to be able to do all the things, not just some of the things?
Yeah. And to add to that,
Kim
Ashley,
has a really great example of, oh, go ahead.
No, go ahead.
Oh, I was just going to say, Kim has a really great example too of how AI could really enhance the other side, the patient experience as well.
Thanks, Ashley. So AI chatbots. I recently had an opportunity to do a human-centered design voice of the customer about enhancing digital engagement and delivering healthcare without walls. All patients and providers asked for the same thing, an AI chatbot that they want to simplify the digital engagement and think a chatbot could solve the problem. So we took that feedback and we made it actionable. So the next step will be working on a prototype and testing it with patients and providers. It's not replacing the human, it's getting to the correct human. And something that's so important that I talk about frequently is if we ask for feedback, if we ask our providers, our patients, our stakeholders for feedback, and we don't do anything about it, that's not human-centered design. In order to make it human-centered design, we need to make it actionable.
Great point there, Kim. I was just going to add that I think it's important to just remember that healthcare is, human-centered, and that we really have to differentiate what technology can take off our plates and what aspects of the job really are inherently human. I think when you look at AI, we have to recognize that, it doesn't have a gut instinct like a clinician can have when assessing a patient. It doesn't have empathy or compassion. We simply can't make like a end of life decision with a chatbot, right? When you give the chatbot example, but maybe your example, instead of making decisions or actually getting information to inform them on their care, the chatbot can help them get to the right person on the team to answer their questions and relieve that frustration and streamline that. So I think that's a really good example. A lot of these things really can't be always solved by an algorithm. So I think, just focusing on that compassion and empathy really goes a long way.
Candace and Kim, what a great example of a use case where technology is empowering organizations and people to achieve more. So thinking of that AI chatbot example, right, where we're not saying it's removing the human, we're saying it's really supporting and making the organizations and people that the people who are caring for us achieve more, right? And give better care. So what steps do we as the technology industry need to take in the healthcare space to ensure we're designing these AI solutions that prioritize not only the healthcare provider and the patient, but their greatest needs? How do we do that?
Yeah, I think when it comes to designing any solutions within the industry, we really have to look beyond just like the traditional operational factors like efficiency, productivity, and bottom line. But furthermore, I think we have to really look at designing the solution to prioritize the needs, experiences, and the well-being of the patients and the providers above all else. We really have to adopt that human-first approach that we've kind of been discussing, right? So looking at how we can improve the environment for the healthcare staff, how we can reduce the burden and redundancies within their workflows, spend more time with the patients, I'll say it again, and less time on those administrative tasks. So we really want them to get a place where they can thrive and we have that sustainability. So when we get sick, there's still somebody to take care of us, right? When we get to the hospital. So I think it's important that we look at all aspects of this and really have a more comprehensive approach. For me, it makes sense to have the person closest to the consumer really guiding us to help solve the right problems. So I think looking at how we can include the members of the healthcare team, and that's not always just nurses and physicians. I know we've talked about that here today, but I'm talking, it's a big ecosystem, the housekeeping, transport, nutrition and dietary services, physical therapy, a lot of different disciplines all work together in this complex ecosystem. And I think we really need to go to those people and have them tell us, what are their pain points? What do they want? What do they need in their day that would make their lives easier, make them more efficient? And then really, I think we should be designing the system around that. I think bottom lines is that the frontline clinicians need to be involved with how this technology evolves over time.
And I really love the idea of thinking about it as an ecosystem. So, as a social worker, I love to look at everything as interconnected, kind of like a web. So anytime you pull a string anywhere, the rest of it is going to ripple and it'll shift another piece of the ecosystem. And so even if that shift is positive in one area, it's going to create ripples everywhere else. So when we talk about removing pebbles, just because you remove a pebble one area, it could create a landslide somewhere else for another department or another worker that we didn't even consider as being something that could create a problem there. So it's really important when we think of key players to think about every level of key players that are involved when creating change within the ecosystem, because we need to account for even the most minor of shifts. Even if we think we're creating a change that is going to ultimately benefit the system at large, it still is going to create a pattern somewhere else that's going to impact the workload or create redundancy somewhere or outsource somebody, and that is still an effect on the human. And so we want to make sure that the humans are involved so that they too have a say in how things ebb and flow within the ecosystem, because maybe there's something we didn't consider, or maybe it's not the most efficient because it creates a heavier work burden somewhere else. And so it's really important to consider that everybody should be involved in the systems change to make sure that we're considering all the steps of the process, not just the process in a vacuum.
No, that's great, Ashley. And I like the visual of the thread. You're pulling the thread through, right, to see every single point that's impacted. That's a beautiful visual. Thank you for that. So as I think about taking this just another step further, pulling that thread through even more, what are some of the applications of AI in healthcare that excite you or that you think we as an industry should prioritize to better support you?
I know I'm excited about use of scheduling, which I know a lot of people are starting to utilize and explore. I think when you look at scheduling, you kind of have to break it down into two areas. We have our asset utilization versus our workforce utilization, right? So when we look at assets, we're talking about our CT, MRI machines, OR, bay efficiencies, things like that. And then workforce, of course, is our people and how we allocate our resources. So I personally am in my realm and scope really focus on that workforce utilization. I would love to see how I can better efficiently allocate my resources to have that more throughput and efficiency. But I think it's a twofold. I think that simultaneously, if we're doing that, it's also going to be increasing flexibility for the workforce, which I think is really, really necessary. So I think it's been very inflexible for the nursing team specifically here that I can speak to, how they get to choose their schedules, maintain their schedules, change their schedules. And people have other options now. There's telehealth. There's a lot of other ways that they can go. And so I think, notably, I know I've had people who have wanted to transfer to my department. I think from some of those well-being initiatives we talked about, but also because we do try to be flexible, knowing people have time and things that are important to them outside of work. I've had people that couldn't get off for their child's recital or couldn't get off for different really important family things that only come one time, and then it's gone, and they don't want to live their lives and have that be really their work-life balance. So I think it's really important to see how we can be more flexible also from that customer experience standpoint for the nurses as well. And then also being someone who's created schedules, it is very time consuming and cumbersome, and there's so many moving parts. So I think there's a lot there with creative scheduling plans where we can really focus on letting the nurses work on their own terms, which kind of brings us back to emphasizing that workforce sustainability piece. Again, how are we going to keep it sustainable when we have these projections of all of these vacancies and our healthcare system is only getting, more complex. So.
No, that's a great summary. Anything else to add, Ashley or Kim?
Yeah, I'm sorry, I'm going to go a little off script because I just happened to glance at the Q&A and I was like, oh, that really hits home for me. Because somebody asked about the non-clinical administrative tasks like payroll and how much of a burden of this is for you. And I know Candace and we go back and forth about this all the time. So just for an idea of how interrupting this can be throughout a workday, when you're getting interrupted by tasks of, hey, go click approve on this, go click approve on this, go put this through, go push this through. If you're interrupted 50 to 60 times a day, even just quickly checking it can add up to a 40% productivity loss over the course of a day. And it can take you up to 23 minutes to recover from that distraction. And so when you think about how many times you're distracted during the day, and I can tell you, especially with things like payroll, it happens constantly. And every time you think you're done with it, it comes up again. So the idea of using something like AI to be able to, or any sort of electronic intervention to be able to automate that, think about how much 40% is a huge chunk of your day. So think about how much of your day you would get back to be able to route to other tasks, like connecting with your employees, right? To be able to work with them on tasks that maybe they need to get done. Maybe working on department improvement projects that you want to do to be able to take care of their well-being, right? And payroll is a daily thing for us because our departments are so large. So it's a constant interruption. And that's just one example of one task that we're taking care of on a daily basis. So that really excites me. I saw that and I was like, yeah, that brings a lot of joy to me if that could be solved. The other thing I think that brings me a lot of joy that I saw kind of pop up over here is wearables with patients. I know Kim and I share this passion because the idea, again, I go back to the idea of passive collection of things to be able to use it in an active way. So we have a lot of mechanisms to be able to gather the data that we can use. And like I said, I run a wellness program. So the idea of being able to collect all that we need to be able to personally tailor programming to find out how people are engaging in their wellness and then being able to tailor and recommend things that continue to make lifestyle changes that can create and contribute to preventative care for them, that create longer quality of life outcomes for them is huge. So I really anticipate and look forward to the day in which we can do that in a more effective manner and be able to pull all that information together in an agnostic way that creates an outcome that is usable and easily accessible for all healthcare providers across a lot of different kinds of platforms, so that providers also feel like they can engage in an intentional way with that information to use it to tailor healthcare interventions for their patients. Because there's a disconnect right now, like I said earlier, about the healthcare providers really feeling empowered to know how to engage with the information we have available. And I really look forward to the day where those two arenas come together in an intentional way to create better patient outcomes.
Ashley, I agree 100%. I think wearables really can empower the patient and provide the provider with what happens in between their visits. Candace has shown us that wearables definitely help with nursing to see how are they sleeping, how many steps are they taking. But we take that then to the patient side and we can really do some predictive outcomes to understand what it is. When a patient comes in and maybe they say, yeah, I am walking 10,000 steps a week. But in reality, there may be, or a day, I'm sorry. In reality, maybe they're really walking less than 1,000 steps because they don't know, they're not tracking it. And so I think that's a really exciting space. And even with patient-generated health data, to see what's coming in, but the provider doesn't need to monitor it day by day. It's right when they want to check in, how is that patient doing? Or the patient comes in for a visit of, oh, I see your blood pressure has been pretty consistent. I think that's really an exciting space for us. And I know everybody talked a little bit earlier about, what would we want AI to do? I can say, I'd love it if AI could take some of my meetings for me and also schedule some of those appointments and meetings that I have. But one thing that my team is doing to prevent burnout, and we are not clinicians, is we have something called Focus Fridays, so that we are intentional on our Fridays that we can really make an impact and focus on meaningful projects for our providers and our patients and customers.
I think that's beautiful. AI can do so much, and the future is very bright. But that being said, I want to make sure that I give space for everyone to provide any final comments or any final ideas. Are we good? Awesome. let's wrap up this discussion and summarize what we've heard. I think now would be a good time that, listen, just like the well-being interventions that you're talking about, AI solutions, they need to be consistent with the values of both the healthcare systems and people, to make sure that we are building and exploring the right solutions and the right opportunities at the right time. So thank you for exploring burnout with us. Thank you for exploring all the opportunities. Clinician burnout is huge, right? And we have such an opportunity to really make an impact there, and take care of the people that are taking care of us. We have the opportunity to identify AI versus human tasks, right? And what can humans do that AI cannot? And creating that space for clarity is imperative. The frontline input is also imperative, right? We have to include everyone from the nurses to the folks that are serving the food in the cafeterias. Everyone is involved in this innovation process. And then, of course, focusing on that sustainable workforce and really focusing on how do we ensure that we're addressing the well-being and removing those pebbles. So thank you for that visual. That was a great one. And let's make sure we're asking the right questions so that we spend time on the most impactful and the most priority problems. And with that, I just want to thank you again. And I think there's one last thing we wanted to touch on, Kim. Would you be so kind as to just wrap us up with that last bit of information?
Absolutely. Thank you. And I'll have you perfect. So I love this one. This is an oldie but goodie. This is Everett Rogers' diffusion of innovation theory. And it describes the pattern of how new ideas or innovations spread throughout a society. So under this theory, innovation spreads from a concentrated few users to a large general population across time. As you can see, less than 2.5% of the population chase after change like Candace and Ashley did. And 16% actually run away from change. So I always like to end things to give us something to make it actionable. So I ask all of you, how might we shorten the lag time of innovators and early adopters to the late majority and laggards and continue to be the change makers based on the right problems, the right solutions by using voice of the customer?
Thank you. Thank you to everyone, both the audience and, of course, our amazing healthcare providers here today and experts in the healthcare space. Ashley, Candace, Kim, thank you. And Joe, thank you for the opportunity.
That was incredible. I love ending on a good innovation curve graphic, especially that fun cartoon one. And since we have about 15 minutes left, thought we'd jump into some additional questions from the Q&A tab. So this is one from David, and you guys touched on this a little bit with wearables, but I wonder if there's an opportunity to go deeper. So David asks, AI is often discussed as a way of automating clinician workload. How can AI also empower patients to take better care of themselves and better manage their own care? Any takers?
Yeah. Oh, okay. I'll jump in. I think we have a tremendous opportunity in terms of anticipating how to better care for ourselves by leveraging AI, whether that's integrating more predictive analytics that can help prompt patients or healthcare workers to do something like take a break, go outside, et cetera. And I think Apple's doing a great job of already providing some of this. But I know that there's a number of different startups in the ecosystem that are also providing awesome opportunities to advance better care of patients and people in general.
And I'll just add on too as well. We hope to, and as we look to integrating more within the area in which I work, to be able to add the opportunities to take, like I said, that information we're already gleaning, to use it as a way to individualize and personalize the interventions that we're offering to patients, and to get it to them in a way in which it's valued aligned. So we already know what's going on, and like you said, that predictive healthcare, but how can we also get it to align with maybe some of that wearable information, that smart information of what they're already doing? So how can we increase more of what they're already doing to align with that predictive information, to get them to do more of those things to increase a better outcome in the activity that they're doing? Because patients want it. Patients want to know what to do. They want to know the right thing to do, because a lot of patients are tired of doing the wrong thing for a long time and then feeling frustrated and giving up. So if we can give them better information, and information that they feel like they're succeeding with, they are more likely to do more of it. So that's what I look forward to, and that's what I hope to be able to use to empower them for longer and better outcomes for quality of life.
And one more thing, Ashley, you just jogged my memory here. One thing that we can leverage the power of AI, especially with some of the Microsoft tools, is being able to analyze the document. So, for example, anyone who's seen or experienced Copilot, the Copilot within Microsoft 365 now can actually scan documents and provide summaries. So think about time to care, right? And reducing the time it takes to read an entire document or a patient file, and be able to summarize the key, most important aspects to make sure that we're addressing the problems faster, right? We're getting to that care faster, because as we all know on this call, and you all experience, is minutes can be a matter of life or death. And that's so critical. So the faster that we can get the information in the hands and the correct assessment of the information or the past historical documents, the better it's going to be for outcomes, right? So that's just one primary example in terms of automating and leveraging AI. Next question.
Those are fantastic insights. This is one that I don't think is in any of your particular area of specialty, but I imagine you might have seen some interesting use cases here. So Anne-Marie asks, can you speak to the ability of AI to provide insights for disease intervention? Anything interesting you've seen here? If not, we can skip.
Yeah. So again, my experience goes with wearable. So not so much AI, but just wearables specifically.
Okay.
We've been able to, with our system that we have, be able to target specific protocols that get sent through text messaging and through email to the veterans. So if they're saying that they want to move more and they are using their smartwatches to be able to track their steps, and working with either our recreational therapist or our health and wellness coaches to specifically target movement, we can actually send specific protocols to be able to remind them to get up and move and to do things throughout the day. And it sends specific reminders. That protocol is specifically one way, but we do have another protocol that's integrated with our nutrition clinic, that is two-way communication, where they can report back whether or not they actually fulfilled the goal for that day. And so that's kind of how we've done it. It's not 100% what you're asking, but that's kind of where we're at this point in our healthcare journey. But again, we're really looking forward to the day where it's more evolved.
Yeah. So, I mean, do you imagine a future where some of this might end up being predictive, right? So I'm wearing a wearable.
Yes.
You're looking at my heart rate, blood pressure. You're looking at some other signals on there. I know there's some apps that are measuring even things as far out as oxytocin production, right?
Yeah.
Where you can say like, oh, like it actually looks like there might be something that you missed here because, you're not actually going to your annual physical. You think you're young and healthy, but perhaps we get an insight that's saying like, hey, maybe you should come in and get this checked out. Do you think that that's a future that we have, and if so, any bold predictions on how far away it is?
I think it'll happen sooner in other systems than ours, just because ours is so large.
Mm-hmm.
But I do believe that is a future that's coming. And I'll say that, fingers crossed, I do believe that's a future that's coming, because I work in wellness programming and I've seen how much we've evolved from being diagnosis specific to being proactive, preventative, people taking charge and empowering themselves to be working towards their wellness and engaging with healthcare providers in those centered conversations of, this is what matters to me and this is what I'm working on. And so I really do see the day in which people will be able to get that information and then come back and say, oh, I was prompted to come here because this happened. So yes, I do look forward to that, and I do believe it will happen. Just being in the well-being arena, I think those are the next steps where we actually do turn that information over to our patients to step into that world.
So this is a question that I'm actually personally very curious about as well, because it's something that when we're working with some of the health systems that are building new innovation and AI solutions with A.Team, we often see emerging as a bottleneck. Which Tyler's asking, he says he loves the human-centered design approach with the need to have clinicians involved in the initial discovery of problems to solve and provide ongoing feedback for the design of a solution. How do you balance this with an already heavy workload and time commitment? So, the problem of like you need to do some of the work to end up taking the work off your plate in the long run. Kim, I wonder if you have a perspective here from an HCD standpoint.
Yes, thank you. And so I do identify and realize that providers are very busy. I am actually, after this meeting here, I'm doing field testing with some providers, our frontline staff. What I do is I meet them where they're at when they have an opportunity, and they realize that their input is so valuable that if they don't provide input, again, we can jump to that solutioneer. And so I usually do not have a difficulty finding providers like Ashley, like Candace, that are go getters. They want to drive that change. And that is so important. And there's different ways of recruiting out there also. And I think you have to, if you're having difficulty and you work in a healthcare organization and you're having difficulty getting providers to give you feedback, you need to make it why it's important to them, right? Why would it be impactful for them to provide feedback? Then the other thing that I always do is start small. Start with a pilot. Don't just start big, right? Because with that pilot, then you have a small group of providers that are wanting to drive change and want to be a part of this pilot and give feedback. And that's just so important. Great question.
Yeah, I think that's amazing advice. Anyone else want to chip in? If not, I have another question I think serves as a good follow up here. All right, so with the approach you described, right, Candace and Ashley, you're dealing with the folks who are on that early part of the innovation curve, right? So, which I think transitions well into this question from Michael, which is how do you make sure that the new technology that you're building or being integrated remains accessible for older generations who might be a little bit, slower on the adoption scale or tech adverse? So sort of solving for the problem of building for innovators and early adopters and then making this change less scary, which we see that, AI is kind of scary for a lot of folks. Any advice there?
So I can
So
actually answer that. Oh,
oh,
go ahead, Ashley.
Mm-hmm.
well, it's okay. I was going to reference you anyway and ask you to talk. So I was going to say, I love what Kim does with her focus groups, with her, questionnaires. Um, we do veteran panels. We will do veteran feedback forums. We really encourage getting people to give us the information. Um, but we also need to do it with the employees as well. And so we may be able to train champions in each area to give us give us their take on it, but then also use those champions as almost a train the trainer model within different sections to make sure that they are the ones who are there for those who may need a little bit extra help if something does roll out as a pilot in a certain area and somebody needs a little more assistance. Um, but Kim, if you want to talk a little bit more about how you do this as well, but that's typically, I know in my section, how I do it is if we have some new technology coming in, I try to make sure that we have champions in each area so that people feel supported and that they're not being left to try and learn it on their own.
Thanks, Ashley. And to go back to Michael's question, so sometimes when we think an older generation won't want it or adopt it, that's what I call kind of that bias. And so we won't know without asking them. I used to work with a lot of virtual reality projects, and I would often hear by providers of, oh, but anybody over than 70, they're not going to like it. Well, the oldest patient that I had try it was 101 and loved it. And that's why going to our end users and asking them, so for example, today we're talking about AI, asking them, what do you think of AI? And remember, a lot of older folks, they have younger caregivers that are in charge of their care. So they're wanting those, telemedicine visits. They're wanting things to empower them to help take care of that older parent. And so that's really goes back to asking the customer. We won't know the answer until we actually ask the right questions to our customers.
Yeah, that's I think a really great point, right? We shouldn't assume that someone is just going to be a slower adopter because of maybe age reasons or pre-existing biases. And I think in a lot of ways, the promise of AI is that it's going to be easier than a lot of this legacy software. I mean, it's not like the last 20 years of SaaS, and particularly vertical SaaS in areas like healthcare, has been the most delightful user experience that you've ever seen. Generally, if you understand how to text, you understand how to chat, a lot of current AI interfaces are relatively intuitive. So I think that's such a fantastic point. All right, let's wrap up with one more lightning round question. What's the biggest mistake you've seen healthcare organizations make when integrating new technologies? And what's one quick piece of advice that you have for avoiding them?
I think I see that question in here, and I see the one before that from May. And I was queued up for the one before that with process improvement and Lean Six Sigma, and ensuring that we have a voice of the clinician and that we have that end user involved when we're looking at Lean Six Sigma projects or any process improvement projects at all. So then to answer the question that you asked, Joe, I would say that that's the biggest mistake. Is it's kind of going back to what Kim said when we first started off today, that if we aren't including them and we're making decisions and buying things and spending money to either fix the wrong problem, or maybe it just doesn't meet the mark, or there's some big thing that you didn't anticipate that when you actually go pilot something on a smaller scale, like she mentioned, you could have avoided that. And so I think we lose time, we have increased frustration. I think they're the ones that need to tell us what they need, and then we build the system around that, not us trying to think of what's a good idea and then push it from like that top down approach. And I know we see that a lot with buying of equipment and different things like that. A lot of things are great in theory, but we really need to make sure that we have that buy-in for the end user. And then when we're looking at process improvement, that they have a seat at the table. And yes, workload and burnout, all of that, and resources are slim, but I stand really strongly on that it's really important that we find a way to give them dedicated time to have a seat at the table to help us come up with some of these solutions and find a path forward.
Yeah, amen. Anyone else want to throw a mistake out there, spill the tea a little bit?
Yeah, I think I just echo all that. We work on, I'm not against Lean Sigma Six, but it's not always the answer to what we do. And so we do a lot of projects where somebody's been said, this is the problem that we need to solve. And so, and we solve it You know, we go through the steps of solving it, but they're very time intensive and very laborious. And you get to the end and you implement them, and they're not maintainable and they're not sustainable. And it's because it's not what the problem truly was. It was a problem, but not the most important problem that needed to be fixed. And so for me, it always goes back to what is the right problem that needs to be fixed at the right time? Because maybe it's a problem, but it's not the problem. So I think, yeah, just always making sure that no matter what project framework that you choose to use, that you first find out from the people you're trying to fix, what is it that they want fixed for their buy-in.
I think that's a great place for us to end, as we're in our last minute of time here. The right problem at the right time, solving things that are actually most impactful and not just the use case that maybe gets yelled about the most or first pops to your mind. I think it's such a great insight. Well, I thank you all so much for joining us. It's incredibly insightful. I'm looking at the chat and seeing that provide a ton of value to our audience today. One quick note for those of you who are still on, which seems to be most of the attendees. So the party doesn't stop with A.Team. We have a lot of events coming up, starting with our Future of Finance salon next week, which is hybrid. It's in person and virtual, so you can watch the live stream as well as apply to attend in person here at our NYC Clubhouse. Also in the follow-up email, I'll include a couple of Tech Week events if you're here in New York that we're hosting a really fun pitch night on June 5th. We're going to have some early stage startups in consumer AI competing, as well as another consumer AI event on June 6th. So look out for that. Thank you all for being here, and we'll see you again soon. Have a great rest of your week.